Hello, it is an honor to be here at the International Society of Radiographers and Radiological Technologies World Congress 2021. My name is Sergio Solis. I'm a radiography professor at the University of Costa Rica, and I'm going to take a few minutes to talk to you about the challenges we have in the process of curriculum actualization of the Medical Radiation Technologies program at my university. First of all, I have nothing to disclose. I'm going to start talking a little bit about Costa Rica. Costa Rica is a really small country, but with a huge vision located in Central America. Our university was founded in 1940 and is one of the top universities of Latin America. We are the only university in the country with a radiography undergraduate program and one of the first in the Latin American region. The first radiography in Costa Rica was acquired in 1904, just 9 years after Röntgen's discovery. The University of Costa Rica began the radiography formation with a technical training program in the early years, which evolved in professionalization. In 2001, the undergraduate program in diagnostic and therapeutic medical radiation technologies was approved. It later was actualized in 2008, and we have been forming professionals with this program. But more than 10 years later, the technological advances require us to do an actualization and reformulation of it. We then start the process of actualization, thinking always in an innovative way that will prepare graduates in different ways, taking into account that we want a profession that can legitimately perform diagnostic and therapeutic procedures with the highest quality in all areas upon entering the profession. Our actual core program was approved in 2008, and to June 2021, we have graduated 415 professionals with this program. It has a 5-year duration with both diagnostic and therapeutic specialization that ends with a final degree project focused on a research area. For the actualization of the curriculum, to start, we create multiple commissions for each area integrated with professors, students, and graduates, in which we identify the arguments to consider in the new core curriculum. With this information, we outline a professional profile as how we want our new graduates to be, and in which areas we need to focus. Later, we did a workshop with the same participants and employers to outline the knowledge areas and the material objectives we need to teach to satisfy the needs. And with all this information, we start the pedagogical analysis in how we can teach all that, in which we ask students and professors how they want us to teach and how we can teach all those new areas. With all the information, we start building the new program. Since the conceptualization of the career in our country, we detected 3 main areas: radiography or radiological technologies, nuclear medicine, and radiotherapy. But in this new review, we understand that even when MRI is sometimes understood to be part of radiography, as computed tomography, for the nation of the image creation, we need to comprehend it as a new area. Also, we separate from the curricula and include new areas that even when they were taken into account before, they were not visible as main areas of focus. So we include radiological protection and research. With these areas in mind, we start to create a new core program, and we include radiological protection and research as transversal areas that need to be present in every aspect of the formation of professionals in radiography. Research is important for us because our students end the program with a final degree project focused on research, but also, as was presented in the ISRRT statement on radiography education in 2019, the curriculum should include evidence-based practice, requiring all decisions to be based in the best available evidence. Especially radiographers must be able to adapt to the changing circumstances throughout their professional life. And this is specifically important in a profession as ours, that is in a constant fast change. We need to be able to create professionals with skills to keep the track on the new technologies and with the abilities to integrate new knowledge. And in this need, universities have a major role. We then reorder the areas to general sciences as chemistry, biology, and physics, medical sciences as anatomy and physiology, basic knowledge in medical radiation technologies, and advanced knowledge in medical radiation technologies in each of the 4 areas of focus we outline. The transversal areas, radiological protection and research, and also some complementary knowledge as informatics. And we put all this information in a 5-year program, plus the attitudes, abilities, and values needed in our professionals. If we take a look at the credit distribution of this new core program, it is specifically high in clinical placements. Our students start rotation in hospitals from second year's 4th semester till the end of the career program. Here you can see that all areas are covered with an equitable amount of credits. But this actualization also shows us that there are some other important transformations needed, not only in the subjects we teach credits or the credits we assign. We also need to expand the knowledge and integration of the use of medical images and processing for proper treatment planning and diagnostic. We need to strengthen the research processes from academy and promote the use of medical images in research to find early markers and obtain quantitative data to promote an accurate diagnosis. Integrate new content subjects that promote the use of computer science to improve diagnostic and therapeutic processes, and include within the training the development of skills to work and properly lead multidisciplinary teams. This reflexive process is the cornerstone for the comprehensive improvement of the profession in our country, and of course, also in our region. As a teaching team, we are called to redesign a novel educational process that allows covering the development spaces in which our professionals require, without taking away the humanistic reflection, ethics, and research. I will end this presentation showing you our visualization and image processing laboratory we recently acquired to accomplish our formation goals. I invite you to visit us in Costa Rica, and I leave you here our webpage and my email if you have any regards with my presentation. Thank you for your time, and let's keep in the progression of the recognition of radiography as an important profession in healthcare.